Chapter 12 is covering the endocrine system with glands and hormones. The overview of this lecture, we will discuss hormones with their function, chemistry, the regulation of hormones, that is the negative feedback, and different types of disorders. We'll describe the endocrine glands, including the hypothalamus, the pituitary gland, thyroid, parathyroid glands, adrenals, the endocrine part of the pancreas, sex glands, and the pineal glands. In addition to that, we'll discuss other hormones, how hormones are used in medical treatments, the association between hormones and stress, and aging, on the effects of aging on endocrine system. If needed, please stop the presentation and take a few moments to review the learning objectives for this presentation. I will start the lecture for today by going back to medical terminology. And we call the term endo as having the meaning of within, while the exo means outside or outward. Based on that, we do have endocrine glands that will secrete their hormones inside the circulatory system, inside the bloodstream directly, while the exocrine glands will secrete hormones throughout ducts inside cavities. The products of the endocrine glands, they are called hormones, and those are chemical substances that their main function in our body is to regulate metabolic processes. They will control chemical reactions. They are part of the control system for maintaining the blood pressure. They will regulate water and electrolyte balance, and they will control reproduction and growth. Hormones can be seen as chemical messengers. They will be released by the gland directly into the tissue fluids. They are not carried by ducts inside cavities, and they surround and flood the tissues and the cells from the interstitial or from the extracellular fluid. They also can be carried away from the area where they were produced by penetrating into the bloodstream, and the blood will carry them to other tissues. At the level of specific tissues, the target cells will become activated by the hormones. Once the hormone will attach to a very specific area on the cell membrane, that is called a receptor. Some of those hormones may affect many tissues in our body, like the growth hormone, while other tissues will have a very specific, or other hormones, will have a very specific tissue that will be stimulated. As in the example of the thyroid stimulating hormone, that the target tissue for it will be the thyroid tissue. From a chemical point of view, hormones fall into only two categories. Chemically speaking, they can be either amino acids or lipids or steroids. The amino acids are the non-steroid hormones. They are proteins or related compound proteins, or how they are called amino acid derivatives. And an example for those is pretty much all the hormones, with the exception of the adrenal cortex and the sex glands hormones. The steroid hormones are derived from the steroid cholesterol. So they are a lipid type. They are made out of fatty acids. Most of them are those that are related to the adrenal cortex and the sex glands, and they can be recognized by the ending sterone, progesterone, and so forth when they are related to the sex hormones. Hormone regulation in our body is under the control of negative feedback loops. And those loops are based on predetermined values of certain elements that can be measured inside our body functions. And as an example of that will be the insulin that is involved in the blood glucose regulation, and we'll discuss that in a second in the next slide. The hormone cyclicity or release may follow either a daily or monthly cycle. For example, the adrenal hormones, the cortisol, has a daily cyclicity, while the female sex hormones have a monthly menstrual cycle. We'll discuss now the negative feedback, and we'll describe it. And please take a look now to the image on the left lower corner of your screen. Now, you see that an endocrine gland is connected to a target organ, and the connection between them will be done through that chemical substance that is called a hormone. So once the endocrine gland will secrete a hormone, and that will reach a target organ, the action of the hormone on the target organ will produce a physiological effect, a response from the target organ. And as a result of the physiological effects, some values, some elements in our body will change. Most of the time, those elements, those changes in our body will be circulating. And because they are circulating through the bloodstream, they will reach back the endocrine gland, and through what is called the negative feedback loop, they will stop the endocrine gland from producing the hormone, and thus stopping the overstimulation of the target organ. Now, this is when we look to what's happening in a very focused one gland with its target organ. But what happens as a system? So as a system, we have a highly specialized type of nervous system, and those are the hypothalamic neurons. And those have the ability to produce and eliminate neuroendocrine transmitters. Those will be released, and they will reach the pituitary gland, and you'll see in a second how that is done, and why the pituitary gland is so important. Based on the stimulation of that, the pituitary gland will start to produce tropic hormones. Tropic means stimulating, and the hormone will reach a peripheral endocrine gland. The peripheral endocrine gland will produce a hormone that will reach a target organ that will produce, in consequence, a physiological effect. However, that hormone, because it's an endocrine gland, because it's continuously flowing and being distributed through the bloodstream, will at a certain point reach back both the pituitary gland and the hypothalamic neurons, and through the same negative feedback loop will inhibit, will reduce the function of those, and will prevent the hyperstimulation both of the peripheral endocrine gland and the hyperstimulation of the target organ. Now, if we are looking on the right side of the screen, let's describe one process that, if you remember, we discussed it also when in our first chapters. So if we describe the action of insulin on glucose, we usually will start, let's say, with a meal. So whenever we eat, we introduce a lot of calories into your body, and the calories will come in the form of glucose. So by digestion and absorption of the nutrients, the blood glucose level will increase in the blood. And as a result of that will be an activation, a stimulation of the pancreas cells that will produce insulin. And this because the pancreas has this type of sensor control capability, will be able to measure the level of glucose. And based on that, insulin will be secreted. Now, insulin is a hormone, will go inside the bloodstream, and through the bloodstream will reach every single cell in our body. And remember that the glucose is the facilitator, will facilitate for the glucose to penetrate and get into the cells and be used by the cells. As a result of that, the blood glucose will decrease to usually to what is called the set point. We never, in a normal person, in someone that doesn't have any conditions or diseases, those drops will not going to be under the threshold, under the preset thermostat point. And at that point, when the blood glucose gets back to the set point that is considered the normal level, the homeostasis is restored. This new level, that is the normal level of blood glucose, will be again identified and perceived at the level of the pancreas cells, that they will stop producing insulin, and by doing that, will stop the usage of glucose at the level of the cells. Question number 1. Growth hormone secretions are regulated by negative feedback. Increased blood growth hormone levels will result in increased growth hormone secretion, decreased growth hormone secretion, or no change in the hormone secretion. The answer is, for every increase in the growth hormone secretion, and for what it matters, any other hormone in our body, that will be followed by through a negative feedback, will be followed by a decrease of the same secretion. The first and the main gland that is part of the endocrine system is the pituitary gland, or the hypophysis. It's a tiny gland about the size of a cherry, located in a saddle-like depression of the sphenoid bone at the base of the skull, and it's situated a little bit posterior to the point where the optic nerves cross each other. It's enclosed in a bone, and it connects on the top through a stem to the hypothalamus. And that stem part of tissue, or stalk, is called infundibulum. The gland is divided into two parts with a slice of tissue in between them, and we have the anterior lobe that will secrete pretty much all the hormones that are released from the pituitary gland, and we have a posterior lobe that will secrete only two of those. We'll start describing the hormones produced at the level of the pituitary gland by describing the hormones in the posterior lobe. And there are only two hormones at this level. One of them is called the antidiuretic hormone, or ADH. And the second one is oxytocin. But let's look in each of them. So the antidiuretic hormone, or ADH, is also called vasopressin. The main function of this hormone is to promote the reabsorption of water from the kidney tubules, and by doing that, to decrease the water excretion. In other words, it's called against diuretic, or diuresis, which means producing urine. So it's that hormone that will reduce the production of urine, will concentrate the urine. And when I say concentrating the urine, it means that will be less and less and less fluid in the urine. I will still have the particles, but I will have less solvent, less water inside. So antidiuretic is maintaining the blood pressure by doing that, especially in those states that the body may become dehydrated. And by doing that, is maintaining the blood pressure and the normal function, or almost normal function, of the heart. Now, when the body is having a lower than adequate secretion of antidiuretic hormone in very specific situations, then a condition that is called diabetes insipidus is produced. So to not confuse, diabetes insipidus means pale or without any taste. It means that the urine is very, very diluted. So in a case of diabetes insipidus, high quantities of urine will be eliminated because there will be a lot of water. The water will not going to be saved because we don't have the mechanism to save it. And to not be confused with what is called diabetes mellitus, or your regular diabetes that we encounter most of the time, which is called mellitus. Mellitus means the sweet type of diabetes. The second hormone, the oxytocin, its main function is to produce uterine contractions and will trigger milk ejection from the breast. So because of that, there is a product that we have an artificial made oxytocin substance that can be used in the process of childbirth to promote uterine contractions, and as a result of that, to prevent bleeding in some patients. The anterior pituitary gland has a little bit more hormones released than we have from the posterior part. Now, specific for the anterior lobe is the way that those hormones will be released. So the anterior lobe is controlled by secretion that is called releasing hormones. And these releasing hormones travel down through a web of blood vessels that are called the portal circulation. So this circulation is in fact a detour because some of the blood that will leave the hypothalamus will travel through those capillaries towards the anterior pituitary gland. And once they flush the anterior pituitary gland, they come back and they will return to the heart. And as a result of that, the secretions of the pituitary gland will be distributed to the whole body. At the level of the hypothalamus, we have the releasing hormones. And you will recognize them because they are marked with an R and H, capital R and H, releasing hormones. And their names will be the same names with the hormones that they produce in the pituitary gland. For example, if we are talking about the growth hormone, the hormone that will influence the release of the growth hormone will be the growth hormone releasing hormone. And this is an example of how just to review, how the anterior pituitary hormones are stimulated by the hypothalamus. Let's say at the level of the hypothalamus, the neurons are producing right now the thyroid releasing hormones that will travel through the portal system. You can see the arrows moving down through the infundibulum to the anterior pituitary gland, where they will stimulate the cells to produce the thyroid stimulating hormone, and the thyroid stimulating hormone will stimulate the thyroid gland to produce thyroid hormones. As a result of that, T3 and T4, that's the name of the thyroid hormones, will be released in the bloodstream, and that blood will flush all the areas of our body, including going back to the brain and to the level of the pituitary gland and the hypothalamus, and will signal over there that there is enough thyroid hormones in the bloodstream right now. So the action, the stimulating action of the pituitary gland and the hypothalamus will be diminished or even stopped. You kind of understand now, because there is a richness of hormones that are released from the pituitary gland. You can understand now why we call this gland the master gland, because it influences pretty much all the other glands in our body, that they will influence the activities and structure and development of pretty much the entire body. And we'll discuss them one by one. So I'll start with the first one on the list. It's called thyroid stimulating hormone, or the thyrotropin, that will stimulate the thyroid gland, that will produce T3 and T4, the thyroid hormones. We have the adrenal corticotropic hormone, or ACTH, that will stimulate the adrenal gland. We have the growth hormone, and this is called somatotropin. And the activity of this hormone is on most body tissues, promoting creation of new proteins and buildup of the tissues that are essential in the growth process. Growth hormone causes increase in size, in height. It's essential during the growth periods of a human being. It's at its highest levels during the youth age, and function on the bones before the closure of the long bone epiphysis. We'll discuss what happens with every single one of them if there is a deficiency or an increase in or an overproduction of this type of hormone. Prolactin stimulates milk production of the breast. FSH, the follicle stimulating hormone, stimulates the development of ovarian follicles and the maturation of the egg inside those follicles, and that in females. And in males will promote the development of sperm in the testis, while the LH, or luteinizing hormone, will cause ovulation and promote progesterone secretion in females, while in males will stimulate production of testosterone. And those two hormones, FSH and LH, are called gonadotropins because they act on what is called a gonad, or the sexual or reproductive organs in our body. They also regulate the growth, development of all the reproductive functions. They start to be secreted at high levels at puberty. This is a slide that summarizes both the way that the stimulation of those hormones to be produced happens from the level of the hypothalamus, and you can see it summarizes each of the hormones that I mentioned before. There are two of them that I didn't mention, and we'll discuss them as a separate category. We have in the anterior pituitary gland a few cells that are able to produce what is called melanocyte stimulating hormone, or MSH, that will action on the melanocytes in the skin and will promote a skin darkening. And also we have endorphins that are inhibitors for pain perception, and they will break the pain pathways at the level of the peripheral nervous system. We'll discuss now the pathology. What happens if there are two ways that the glands can malfunction. They may either secrete or produce too much of the hormone as a result of not responding to the hypothalamus command, or they may have an inadequate secretion. It may be too small. So you see in this picture, this gentleman on the left side, his name is Robert Pershing Wadlow, and he existed. His height was 9 feet. That's about 2.7 meters, and a weight of 488 pounds. And unfortunately, because his big size, he died at age of 22, only because his heart wasn't able to keep up with all the needs the body had. So his large size was a result of an overproduction of growth hormone during his youth age, during his puberty. And the moment that he died, it was related to an infection that was overstimulating his heart, but they were able to find a tumor in the hypophysis, and that's how they explain his size. Now, when it happens in people that are still in the process of growing, it's called gigantism. While if it happens in an adult that already reached the maturation and is not growing anymore, but at a certain point the tumor will develop and will start overproducing growth hormones, what happens is what you see in the right side of your screen. In the picture, you see a series of the pictures of the same individual throughout different stages of what is called an acromegaly. And in acromegaly, the patients will exhibit just the extremities or the prominences of our body will continue to grow, like the nose, the chin, the ears, hands, and feet, as opposed to the whole height of the body that will not grow anymore, will stay the same. So they become this kind of dysmorphic, will have those changes that make them look a little bit Frankenstein-like. You can see how those changes happen in this gentleman. Cushing disease and the Cushing syndrome. So in Cushing disease, what we have an excessive hyperproduction of ACTH, and as a result of the stimulation, the pituitary gland overstimulates the adrenal gland to produce cortisol. And as a result of that, we have um, all the signs and symptoms of Cushing disease. And that would be the patients will have this kind of very round face. In female, we'll see what is called hirsutism. We'll see a lot of uh, facial hair in females, which is not obvious and not natural for females. They will have they will look like kind of froggy. They will have this kind of round body with a big belly and extremely thin limbs, kind of a wasting of the muscles at the level of the limbs while the body becomes kind of round. They start to have increased weight based on accumulation of adipose tissue on the abdominal sides, and they will exhibit those abdominal stria. And in addition, they will have that hump, an accumulation of fat in the back of the neck, kind of interscapular, in between the two scapulas. Now, on the other hand, this is the Cushing disease. The Cushing syndrome will be an adrenal tumor that is independent of the activity of the pituitary gland. You can see here the dwarfism, and if there is no growth hormone in the early stages of development, as a result, we'll have the little people or the nanism that has as a cause is not genetic. The parents are normal and the genetics of the baby are totally normal. They do not have the genes for dwarfism. However, the child is not developing because they do not have any hormone to stimulate the growth and development of the bones and tissues. There are some benign tumors that are called prolactinoma that will produce or exacerbate the production of prolactin. Prolactin is not supposed to be secreted outside the context of a pregnancy. It's a hormone that will start to be produced before starting the labor and sometimes after the end of the birth. And it's a hormone that prepares the mammary gland, the breast, for production of milk. It's also stimulating the elimination of milk once the lactation is established. However, a tumor out of those cells can develop sometimes. And as a fact, it's probably the most common pituitary tumor that we have. It has a very low risk. In most cases, patients may have no signs of symptoms. In other cases, this tumor may be diagnosed when we are investigating causes for infertility. In other cases, may see lactation that starts to happen in a woman that is not pregnant. Also may cause infertility and impotence in male because it has a female type of behavior. The hormone will inactivate the testosterone in males. And in some females, if it happens in midlife, we may see changes in their menstrual cycle. Question number 2 is asking you which of the following hormones is secreted from the posterior pituitary. And the options that we have are antidiuretic hormone, growth hormone, melatonin, and oxytocin. The hormone, the only one that is secreted from the anterior pituitary lobe, is the growth hormone. Discuss now the thyroid and the parathyroid glands. And thyroid gland is located at the level of the neck, and is probably the largest one out of all the endocrine glands, if we are not taking in consideration the pancreas, which is a very special case of gland. Is made out of two roughly oval lateral lobes that are connected by a thin limb of tissue that is called the isthmus. The thyroid gland is enclosed in a capsule. And you can see the tight relationship that the thyroid gland has with main structures at the level of the neck. It covers anteriorly the trachea, is just under the larynx, and on the thyroid sides, we have the main neck vessels. We have the jugular veins, and we have the carotids that are coming and they are passing the gland very, very close to it. In addition to that, the thyroid gland is innervated by it's receiving some nervous supply from vagus nerve, and that's important in surgery because the vagus nerve can be compromised. Also, if you look on the right side of your image, you see a posterior view of the thyroid gland, and you can see that there are four tiny green dots on it, and those are the parathyroid glands. So the parathyroid glands are kind of embedded very, very close, located to the tissue of the thyroid gland. And it's important to know that because when we perform thyroid surgery, we may injure those glands, or we may, by mistake, remove them along. The thyroid gland is producing two hormones, and they are the main metabolism regulating hormones. We have the T4 that is called thyroxine, and in its structure, it's T4 because it has 4 iodine atoms. However, this hormone has very low activity at the level of the cells. We have another one that is produced in small amounts by the thyroid, and it's called T3 because it contains only 3 iodine atoms, and it's called triiodothyronine. And this one has a high activity, whenever it's in high amounts, will increase the metabolic rate, will increase the heat generation, and as a result of that, the wasting on the body. Thyroid hormones, along with the growth hormones, are essential in order for the body to grow and develop, especially in the young age. Whenever thyroid hormones are not present, the development of the central nervous system, especially of the brain, can be highly impaired. So if I need to summarize those, we have the T3 and T4 that will be secreted from the thyroid follicles, and they are involved in metabolism. They increase the metabolic rate. They break lipids. They're essential for development and maturation of nervous system. While we have another hormone that is also secreted in the thyroid in different cells, not in the same type of cells as the thyroid hormones, that is called calcitonin. It's secreted by the C cells in the thyroid gland. And the main function of the calcitonin is to lower the circulating levels of calcium and phosphate. So in other words, if you remember the function of the osteoclasts that are removing and pulling out calcium and phosphorus from the bones, the calcitonin will inhibit their activity. On the other hand, calcitonin will increase the deposits of calcium and phosphates. Calcitonin will activate the osteoblasts, though that are promoting the deposits of calcium. Now, if you look into these pictures, because now we're going to move soon into discussing the parathyroid gland, the lower image on your right side, you can see the metabolism of calcium, and you can see how if the calcitonin is promoting the deposits of calcium inside the bones and is decreasing the elimination of calcium at the level of the kidneys in urine, the parathyroid hormones, those that are secreted by the parathyroid glands, will have just the opposite activity, completely in a mirror, opposite activity from the calcitonin. The parathyroid will stimulate the osteoclast, will remove the calcium from the bones, and will increase the elimination of the calcium in urine. We'll look now into disorders of the thyroid gland, and we'll start with the goiter. And goiter, as a general term, means an increase in size, an overgrowth of the thyroid gland. and usually is the result of an overstimulation of the thyroid under the influence of the TSH. If you remember, that will be the thyrotropic stimulating hormone. And we have two types of goiter. One of them will be that is called a simple goiter. And in this case, when we examine the patient, their gland we feel the gland when we palpate it is very smooth and uniform. Now, in the other type, which is called the nodular one, the outside surface of the thyroid that we can palpate through the skin of the neck will have this kind of bumpy feeling. And the goiter can come either with hyperproduction or with underproduction of the hormones from the thyroid. Usually the simple one is a hypo type of goiter, while the nodular type of goiter will have a hyperproduction of the hormones. Another type of disease or disorder is when the gland is not producing enough hormones, and that condition is called the hypothyroidism. And we have two types of that. No, actually, we have more than two. We have the congenital one that will result from a total failure of the thyroid to develop during the fetal development. And as a result of that, will be repercussions in terms of mental and physical development. What we need to do is to be able to identify this condition at a very early stage, because we have the substitution treatment. The fact that someone was born without a normal developed thyroid gland and without the hormones doesn't mean that now in a modern society we cannot supplement and replace those hormones with whatever they need. Now, by law in the United States, all newborns are tested, examined and tested to be able to diagnose immediately from the first 24 hours of life if they have any issues with the thyroid, because again, the thyroid hormones, we need them since day one. So that's why those babies will need to have replacement of thyroid hormones immediately. Now, a second type of it's called Hashimoto thyroiditis. And it's common in adults and is the result from an autoimmune destruction of the thyroid tissue. In this type of conditions, when we have an autoimmunity condition, there will be antibodies that the body will produce that will attack own tissues. So the thyroid gland will be attacked by antibodies. And this condition is an inflammatory condition, is common in women between 30 and 50. And as a result of that, the tissue will be completely destroyed at a certain point and replacement therapy will be needed. Another type of hypothyroidism in adults will be as the result of surgery, mostly for cancer. And in this case, again, the patient will receive replacement therapy. Another type of hypothyroidism is what is called the endemic goiter. And this results from a lack of iodine that is totally essential for synthesizing the thyroid hormones. Without the iodine, the thyroid, even present and even in good condition, will not be able to create anything. Now, imagine that your body at the level of the pituitary gland and the hypothalamus perceives that there are not enough thyroid hormones in the bloodstream. Then the hypothalamus and the pituitary gland will release the thyroid stimulant hormones that will stimulate and stimulate and stimulate more and more and more the gland. However, the gland is unable to produce anything because it's lacking the materials, the main components for producing it. Nowadays in the modern world, we don't really see that. It was until 100 years ago, there were some areas in the world that they did not have enough iodine in the water in the area where they lived. That's why it was called endemic. In some areas, it was present at all times. Nowadays we prevent that by having salt that is iodized, and sometimes it's even added to in places in those areas that we know that they lack iodine. It can be added in other food products. Now, another case of hypothyroidism can be the result of exposure to radiation therapy, either for a therapeutical purpose, because we really need to do that on purpose, or because it was a result of an accident, like in exposures to radiation in different workplaces, like it was the Chernobyl or the accident that happened in Japan a few years ago. Now we have another type of malfunctioning of the thyroid, which will be the hyperproduction. So in this one, that's overactivity of the thyroid gland with an excessive level of hormones in the blood. We have the type that is most common. It's called Graves' disease. In this, we have an enlarged thyroid gland. It's called the goiter. And we have a typical facial expression, and I will show you a picture in a second. Now, there is another situation that is called a thyroid storm that happens in viral conditions when the thyroid may be affected by a virus, like an infection, and that's a release of an instant and a very high level release of thyroid hormones in the body. This is a compare of and contrast of the thyroid conditions. You can see A is the hypo and B is the hyper. If in hypo, it's a low metabolism, weight gain, cold intolerance, they are tired all the time, they have this swelling of legs and face. Now, on the other hand, we have the hyperthyroidism, that they have weight loss, they have heat intolerance, they are nervous and shaking all the time, they are sweating all the time, and very, very particular for the hyperthyroidism, and almost putting a diagnosis on them from the moment that they step on, in front of the door of the medical office, is this type of eyes. It's called an exophthalmos. Exo, outside, ophthalmos, eyes. The eyes look like they are popping out of the orbit. It's not that the patient is trying to open the eyes very wide. That's the normal type of the eyes that they have. In human beings, it's not natural to see the sclera, to see the white part on the superior and inferior aspects of the eye. And you can see in this patient, we can see the sclera everywhere around the eye. In a normal patient, we see the sclera a little bit on the medial and lateral sizes of the eye and not on the upper or lower palpebras. This type of exophthalmos is called pathognomonic. Pathognomonic means it puts the diagnosis on the patient even before asking them why are they in, what happens. A good idea is to ask the patient to show you an ID. Most of us do not have an ID that we made a couple of weeks ago. So most of our IDs are a few years older. So you can look at that picture and compare that picture with how the patient looks right now, and you will observe immediately the changes. The patient sometimes may not observe them because they see themselves every day, and those changes will happen not overnight, but in time, gradually, so they will not want to recognize them as a change. Also, if you can pay attention to the neck of the patient on image B, you can see it looks like you can almost see the shade and the shape of the thyroid on the base of the neck of the patient. It kind of protrudes outside. It's standing out. Again, the hyperthyroidism, and this is a small cartoon that is summarizing the symptoms. They have this type of eyes. You can see here again the exophthalmos. They have they cannot stand heat. They have weight loss. They have something else. They have very frequent bowel movements because their metabolism is so accelerated that their bowel also overworks. They sweat. They have pounding heartbeats. They have this kind of very increased rhythm of the heart. They have difficulty sleeping and tremors. They are very nervous, and they have fine and brittle hair. On the other hand, the hypothyroidism, if it happens in an adult, they will have intolerance to cold, they will gain weight, they will be constipated with dry and puffy skin, they retain water, they have thin hair, they have impaired memory and depression, they will have fatigue and muscle joints. Now, the picture on the right side, it shows you a baby before and after the treatment with thyroid supplements. Now we can see on picture A how the fascias, it looks like something is not right with this baby. And because their hypothyroidism comes with water retention, especially in baby cases, their tongue may look very, very big and may protrude kind of out of the mouth, and their mouth will be a little bit open all the time. And you can see the same baby a few weeks after starting the treatment, how it looks like a perfectly normal and engaging baby. And this is how quick we can fix if we know what we need to fix. Thyroid cancer is usually a condition that will involve one nodule, not more than one. It will be a lump that can be felt on the neck, and they may complain of pain in the neck. They may have and observe a change in their voice. Their voice may become hoarse, like they go through some kind of flu or something. They may complain of difficulty swallowing. They may have a chronic cough. They may have swollen lymph nodes. Those are typical signs of cancer in an area. And as general signs of cancer, they will have unexplained weight loss, fatigue, and weakness. As I started to tell you before, the parathyroid glands, they are those four glands that are located on the posterior side um, of the thyroid gland, and their main function is to secrete the parathyroid hormone. And parathyroid hormone is will start to be secreted from the glands the moment that the calcium concentration in blood will drop under the thermostat type of level that is decided under the normal level. Now, in addition, together with the vitamin D3, which is calcitriol, the PTH will raise the blood levels of calcium. Now, when we have an excess activity of, in terms of disorders of the parathyroid hormone, when we have an excess activity of those, we'll have brittle bones because more and more calcium will be released from the bones and transferred to the blood. And as a result of that, not only that we'll have brittle and weak bones and a lot of a cluster of fractures in the same patient, but also because the calcium it will be at high level and the kidneys will perceive that and will try to deal with a new situation, will try to eliminate those the calcium, the kidney stone will form as a result of that. Now, when we have a deficiency of a parathyroid hormone, we'll have, especially if the glands were accidentally removed during the surgery of the thyroid, that will result in what is called tetanus or tetany. And the tetany is a muscle spasm that can be generalized or it can be localized in some skeletal muscle groups. So again, to summarize the functions of the parathyroid hormones, there are two types of cells in the parathyroid, the chief cells that are secreting the PTH, which is a total antagonist of calcitonin that was secreted by the C cells in the thyroid. And we have what is called the oxyphil cells. They are bigger, larger, and we are not really sure what is their function. So to summarize the tetany a little bit, it's a severe muscle cramps. When it's generalized, will produce what is called a convulsion. when it's localized to a group of muscles, will produce the twitching of those muscles. During a convulsion, extreme flexions of the wrist or ankle may be produced, and as a result of that, the contraction may damage nerves, ligaments, and tendons. Now, because the larynx is made out also of striated fibers of skeletal type of muscle, larynx is also called the voice box. We speak by the help of the larynx, so we have control over the larynx. That's the easiest way to remember which muscles are striated and which are not. If you have control over it, then it is a striated muscle. If the tetany at very, very low levels of calcium happens, may put in danger the life of the patient immediately, because it may close completely the trachea, so they are not able to take a breath in. The treatment will be immediate intubation with IV calcium by calcium gluconate to improve the levels in the blood. And also in patients that are going through convulsions, we give them anticonvulsive therapy and sedatives to put the brain at rest mainly, and produce a relaxation of the extreme contractions. Adrenal glands. So adrenal glands are a pair of glands that they are each situated on top. They sit kind of like a tiny hat on top of the kidneys. And structural, you can see them in the picture. They have two areas. They have an outside area that is called the cortex. And see, it reminds you the same rule from the nervous system. The outer part is the cortex. The inner part is the medulla. So the outer part, the cortex, will produce corticosteroids and mineralocorticoids and androgen hormones, while the inner part, the medulla, will produce epinephrine, which is the hormone involved in the fight or flight reaction. So let's see what will stimulate the production. And I'll start with the epinephrine because it's just one. Whenever our body is put in an extreme state of stress, and stress is not, nowadays we call stress everything that is psychologically related. An infection can be a stress, and being exposed to extreme heat or extreme cold temperature, that can be a stress to the body. Every type of stimulus that is extreme, it's high enough to make the body to go through a full process of adaptation to that, can be considered a stress. So the epinephrine is usually released as a response and as a stimulation of the sympathetic nervous system. As a result of that, the body is put into fight or flight state, and the effects of that will be a stimulation of the smooth muscle contractions in the arterioles, which is called vasoconstriction. And by doing that, the blood will be redistributed from those areas that are not essential to protect my life right now to those areas that is essential to get as much oxygen as possible. And those areas are the brain, the heart, the muscles, and the kidneys. As a result of that, there will be an increase in the heart rate, an increase in the metabolic rate, and more glycogen from the stores will be converted quickly into glucose. Will be an increase at the level of glucose in my blood based on the stores that based on the storage products that I have, the glucose, in order to maintain the activity that needs to be involved in the action. The adrenal cortex will produce, as said, three types of hormones. We'll have the glucocorticoids, and the typical for this category is the cortisol. And this is also a stress hormone. The glucocorticoids will increase the blood glucose. are those hormones that are increased in starvation states. And when I say cortisol, think about hydrocortisone or prednisone. It's the same family, it's the same type of hormone. And as a result of increasing the blood glucose, will also reduce the immune activation. It's important to say that, again, being a stress hormone, will be also at high levels. The cortisol will have very high levels in those people working nights. So if you're one of those people that works nights, um, human beings are not made to live in the night. We are not nocturnal creatures. We are diurnal. We need to live and have full activity during the day. If you need to be fully active in the night, the brain perceives it as a stress. And as a result of that, the cortisol will be very high. That will increase your blood glucose. However, your body will feel a lot of time the feeling of being tired will be perceived more as feeling of being hungry. So a lot of time people that are working nights have a hard time losing weight, or even they are gaining weight, and they kind of cannot explain because they do not eat more than before. It's only because the body will perceive that as a stress and will deposit everything in as fat deposits. Mineralocorticoids, they are involved in the electrolytes balance. They will control the sodium reabsorption, while the potassium will be eliminated at the kidney levels. And the typical, the main hormone in the mineralocorticoids hormones will be the aldosterone. The androgens will be the male sex hormones. So see, it's interesting. You'll say, oh, okay, wait a minute. So androgens in a woman? Yes. Androgens are present in the body of both women and men. However, they are in very small amounts. So because they're in small amounts, they will not create any kind of male changes in a female, and also will not going to be enough for a male at puberty to mature. The level of testosterone needed for puberty, for going through puberty and maturing as a male, needs to come from the testes, that they are able to produce the necessary levels and maintain also the necessary levels. So let's describe a little bit how aldosterone will regulate sodium and potassium, and how aldosterone is actually involved in the fluids regulation. So let's take the situation that we have someone that is dehydrated, um, or has a sodium deficiency, or is hemorrhaging, losing fluids in one word. So when we are losing volume, there will be a decrease in the blood volume. As a result of a decrease of the blood volume, a decrease in the blood pressure will happen. That will be felt at the level of the kidneys first. That will increase secretion of special substances that we'll discuss them in urinary system. However, one of them will produce vasoconstriction of the arterioles and will stimulate the adrenal cortex. That on its own will produce more aldosterone, that at the level of the kidneys will reabsorb the sodium that was filtrated, will reabsorb the water along with that, because water is following sodium passively, and will eliminate, as an exchange for the sodium that it's important to maintain the blood pressure, will eliminate potassium and protons, because if you look at that, what's important for the kidney is to eliminate a positive particle. It doesn't matter if it's a sodium, potassium, or a proton. So in those cases, while saving sodium and saving water, the urine becomes more acid. This is summarizing the function of cortisol in stress. But let's look at something else first. We have um, here detailed the symptoms of someone that has a hyperproduction of cortisol as opposed to of a underproduction of cortisol. So in high production, will have high blood pressure, will have fatigue. However, fatigue appears come also in the low cortisol levels. They will have erectile dysfunction, a reduced sex drive, weight gain, hyperglycemia, insomnia, and poor concentration. On the other hand, in the low cortisol levels, we'll have those people that will crave sweets. It's just the opposite. If the other one will have hyperglycemia, the low cortisol will have the hypoglycemia and they will crave sugars. Um, this one will have also a decreased sex drive, irritability, and anxiety. They will have also weight gain and a depressed mood with insomnia. So we have two types of disorders of um, the adrenal cortex. We'll have those that will have the hyposecretion. Again, that's the common denominator when we are talking about endocrine glands. We may have hypo or hypersecretion. For the hyposecretion, we have what is called the Addison disease, while for the hypersecretion, we have the Cushing syndrome. The Cushing syndrome um, is the most of the time the result of an adrenal tumor, and the treatment will be with cortisone. Those people will have hyperglycemia, central obesity, and muscle loss on the limbs with what is called virilization. It means looking more and more like a man. If you look in the picture, this patient that you see in front of you, it is a woman. But you can see that she looks more and more like a man. They have this kind of moon face, like full moon face, very, very round type of face. You can see the hump in the back. You can see how there is almost no neck. The back kind of connects with the neck, and you can really see. We do not see the whole body, but you can see the profile of the shoulder and the arm, how it looks smallish compared with the rest of the body. We will discuss here a little bit about the pancreas, and we'll focus on what is called the endocrine pancreas. So the pancreas is an organ located in our abdominal cavity in the upper and posterior part of the abdominal cavity. And in terms of structures, it is made out of two components. We'll have the islets that are areas of pancreatic tissue that is able to secrete hormones. And we'll have the acini that are a different type of cells organized like as an exocrine gland that will secrete the digestive enzymes that through a duct will be eliminated inside the digestive system. Now, the hormones of the pancreas are two, not just one. Probably the one that we talk a lot about and it's most common is the insulin, and this is produced by the beta cells of the pancreas. And the main function of the insulin is to regulate the glucose homeostasis through, again, a negative feedback. Any increase in the blood glucose will stimulate the production of insulin, and as a result of that, the insulin will stimulate glucose uptake, will facilitate the entrance of the glucose in the cells, and will increase the use of the glucose by the body cells. Now, in addition to that, and because it's promoting the usage of the glucose, as a general result, the insulin will have a role in tissue building. Fatty acids will become triglycerides. Amino acids will become proteins. It's a build-up type of hormone. The second one will be the glucagon, and this is produced by the alpha cells in the pancreas, and it's also involved in regulation of blood glucose. When blood glucose levels will decrease, let's say during night, we don't eat, so we are fasting. The glucose level may decrease to very low levels, and that's the moment when the glucagon will action at the level of the liver and will increase the production of glucose from glycogen, will break down the deposits to maintain the level in the blood. This is a macroscopic image of the pancreas that sits in the C shape made out of the um, duodenum. And here's a detail of the image where you see the acini, the exocrine pancreas, eliminating the pancreatic juice in a duct that will be eliminated in the digestive system. And surrounding the acini, we have the alpha and beta cells that will eliminate their products straight into the bloodstream. You can see here the acini, which are a lot compared with the pancreatic islets. And islets is the term for islands. There are a few islands in a big sea of pancreatic tissue that is exocrine mainly. Let's summarize what happens and how insulin and glucagon work together. So let's say we can start anywhere, but let's start at the level of fasting. Um, Whenever we are fasting, the blood glucose will decrease, and as a result of that, the low level of glucose will be perceived by the alpha cells of the pancreas. That will secrete the glucagon, that will action at the level of the liver, that will release in the bloodstream more glucose. As a result of that, the blood glucose level will increase. Now, we can start to look now on the same place with a high level of blood glucose that's in the situation of food intake. And that high level of blood glucose will stimulate the beta cells in the pancreas that will increase the elimination of insulin, that at the level of liver and skeletal muscles and all other end organs in the body will increase the glucose uptake that will facilitate the entrance of glucose in the cells, and as a result of that, the blood glucose will decrease. Conditions that affect the pancreas, the most common one is the diabetes mellitus. And in the diabetes condition, the pancreas is, there are two situations. It's either that the pancreas is not producing enough insulin, or the insulin is not efficient at the level of the cells. And this will split your condition into two types. We'll have the type 1 diabetes, that the pancreas is not producing enough insulin. And this is because there was a certain destruction of the islands by autoimmune response. It happens in children and young adults. That's why it's called the juvenile type of diabetes. And in this condition, they need insulin treatments their entire life to manage the levels of glucose in their blood. The type 2 diabetes, or the adult type of diabetes, is a result of an increased resistance to insulin, especially in those that expose their body to high levels of glucose all the time. And as a result of that, the cells will respond less and less to the action of insulin. That's why it's associated with obesity, and the main treatment will be to change the lifestyle to become more active, and the treatment will be with medication. Only in very advanced cases we'll use insulin. Usually we'll use pills, or what is called oral medication. Another type of diabetes is the gestational diabetes. Gestational diabetes is associated with pregnancy, and is more common in those women that have a metabolism that is borderline for diabetes, and in association with another condition as pregnancy, where the needs and the balances associated with glucose are fine and continuous, they may exhibit all the signs and symptoms of diabetes. Most of the times, the gestational diabetes completely disappear once um, the the birth happens after the delivery. However, having gestational diabetes exposes both the mother and the fetus to some complication, and we'll discuss that when we'll do OBGYN in term 3, and also puts the mother at an increased risk to develop on her own diabetes later in life. The sex glands, or the gonads, are the ovaries for the females and the testes for the male. They produce both the hormones that are necessary for the development of the sexual characteristics in individuals as female and male, and also they will produce the gametes, the sex cells, the sperm and the ova that are important for the reproduction process. The sex glands will start to function at puberty and will function throughout the entire life until late when we develop. In female is more evident, it's called menopause. However, male can go through a slowing of their hormonal activity also, and is called andropause. Now, in terms of secondary sex characteristics, those will include, depending on the sex, will be development of different types of development of bones and muscles, because males and females do not have the same bone and muscle structure. Will be development of breasts in females, and growing facial hair and body hair in certain areas as opposed to other areas in females. Will be a deepening voice in males. So in terms of hormones, the testes will produce the androgens, with the main product being testosterone, while in females, the ovaries will produce estrogen and progesterone. The pineal gland is a small and very kind of flat, conish gland. I hope that you can identify it in the picture. It's a very small one. The pineal gland is bolded and on the left side of the image. Now, it is located in the midbrain, and its main function is to produce a hormone that is called melatonin, that will be produced especially when we are exposed to dark periods. And darkness means absence of light. This hormone is produced in very low quantities or almost not produced at all during light exposure. So this hormone helps us to maintain the normal and regulates the normal sleep-wake cycles. Whenever there is an increased production of melatonin, this may delay the process of puberty. There is a good function for the melatonin. It maintains our deep sleep and allows our body to rest, and especially for the brain to get into the deep stages of sleep in terms of waves that allows the brain to recover and reset energy for the next period of being awake. We have a little bit more hormone sources, and usually the hormone, we apply this term to endocrine glands. However, we found out that will be other tissues in our body that will produce some hormone similar to hormone substances, and one of those will be the leptin that is produced in the adipose tissue, and the leptin is known to control the appetite. And we know now that those patients that are obese or have high BMI, they have a very low level of leptin. And because of that, their appetite is increased. They're able to eat more and more and more. Also, some leptin type of or appetite regulating hormones are also secreted at the level of the small intestine cells. The kidneys will produce a substance that is called erythropoietin that will stimulate the blood cell production in the bone marrow. For those patients that have end-stage kidney failure, this substance is not produced in their kidney, and they have anemia. They need to receive it as a medication supplement. At the level of the atriums or the upper chambers of the heart, there is produced a substance called atrial natriuretic peptide, and this is produced as a result of an increased pressure, increased volumes at the level of the atriums. So as a result of that, of action of the ANP, sodium will be eliminated in the kidneys, and with sodium the water, so the volume will be reduced. Placenta is an organ that is secreting more than just one hormone. During pregnancy, there is a wide range of hormones that not all of them we know them and we recognize their functions. However, it seems that a good functioning placenta is essential for a good development of a fetus. Prostaglandins are a group of hormone-like substances that are starting from, they are made out of fatty acids, and the prostaglandin, their name comes from the fact that they were found the first time in semen, and there was a theory that people thought that they were part of the prostate secretions, which is not true. We now know that they are synthesized everywhere in our body cells. They are secreted from cells. They will action just by the cells that they are produced and where they are produced. So they are not flowing like a normal hormone from a gland everywhere in our body, but they will have a local action and they will become inactivated pretty quick. So some of them, what they will do, they will have a variety of effects. They may constrict blood vessels, they may constrict bronchial tubes, or they can just produce the opposite effect. They promote inflammation and they promote uterine contractions. And those two elements, to promote inflammation and uterine contractions, that's how we use them. Because there are products of prostaglandin with prostaglandins that will be applied on the cervix to start the process of birth when there is a delayed or an overturned baby. And also we may have medications that will block the prostaglandin release while trying to deal and treat inflammation. So because I was touching into the element of therapeutical usage of the hormones, I will name a few of them. So we can use cortisol and corticosteroids in treatment of inflammation, mainly in those autoimmune conditions as rheumatoid arthritis or lupus or asthma. We can use them to immunosuppress those patients that are receiving organ transplants also. Oxytocin is used to induce labor, and also in those patients that have hemorrhage after labor, we are continue to use oxytocin to contract the uterus and stop the bleeding. The growth hormone is used to treat definitely those cases of dwarfism, but also for the treatment of children that have a delay in development, physically speaking, not mentally. Insulin, obviously, is for treating diabetes mellitus. The thyroid hormone will be the replacement therapy for hypothyroidism. We use a wide range of estrogen, progesterone, or a combination of both for contraception and also to treat the symptoms of menopause. We use testosterone products to promote tissue building and healing, and there is a wide range of usage for epinephrine that can stimulate the heart muscle, that can produce vasoconstriction, that can treat asthma attacks, that can treat severe allergic reaction. Wide usage of epinephrine, which is the medullary hormone from the adrenal medulla. Wide usages for this hormone. What is the relationship between hormones and stress? So again, stress can be any type of injury that can be physical or emotional that happens to the body. And as a response to stress, our autonomic nervous system, the sympathetic one, will put us in a fight or flight response. It means I'm either fighting now for my life or I'm running away also to save my life. Once the sympathetic nervous system is activated, this one will activate the endocrine response and will activate the stress hormones, which are the epinephrine that will stimulate the heartbeat, will produce bronchodilation, so more oxygen will reach the tissues, will activate the cortisol that will increase the level of glucose in the blood, will also increase the blood pressure, will stimulate the antidiuretic hormone that will conserve the water and will maintain a high blood pressure. Also, the stress will activate in some cases the growth hormone that will increase the blood glucose level also, while the insulin production will completely be reduced because we need high levels of glucose during stress in the blood. The aging effects on the system are similar to those on other systems. Everything becomes slower and slower. Um, there are more and more conditions that are associated with a malfunctioning gland while we are growing older. Probably the highest number of where the highest rate of conditions amongst all will be the diabetes mellitus associated with osteoporosis, which is a malfunctioning in the metabolism of calcium. While all the structures in our body become have less and less blood support and are less vascularized, endocrine system will suffer the same thing and will be a decline in the hormone secretion. Also keep in mind that the central control for the endocrine system is at the level of the brain, the hypothalamus, and the pituitary gland. So anything that will affect in some way the brain, a stroke or any type of other vascular accident will influence also the control center, and all kinds of malfunctionings downstream can happen as a result of that.